What is the surgery? Tell me, when you say the surgery, I know it's probably not pleasant, but still tell me, what is it?
The surgical intervention for periodontal disease, it entitles, there are two ways of we treat it, either by a resective method, which actually we resect the gum away from the pocket, so we minimize the distance between the pocket and the bone, or the gum line and the bone. And we do that by gently separating the gum from the tooth, getting access to the bacteria inside. The bacteria sits on top of the bone and it causes damage and holes in the bone. So our job is to clean up the bone very well. The bone will have some irregularities. Those irregularities get smoothed down.
Okay.
And then when we finish, we put the gum back together, but we don't put it to where it was before. We intentionally push it away closer to the bone, right? Now, with this, the patient leaves the office with some stitches, and the recovery time is just a couple of days, 2-3 days of swelling, and it gets better. Now, once the stitches dissolve on their own, the patient will have what we call gum recession, right? And the gum recession, unfortunately, not only if it's in the front, patients are not gonna like it. They say, well, doctor, my tooth looks longer. There is a little bit of a spacing between my teeth because my scalloping shape of the gum is no longer there, it's pushed away. And that also exposed the root of the tooth, intentionally exposed, right? And what that gives the patient is not only that, aesthetic concern, is also a higher degree of sensitivity.
Oh, yeah.
Yes.
Okay.
And eventually it tapers down, it goes away over time, and there's some products in the market and some toothpastes that help with that. But that is one way of treating it. The second way of most common treatment, and there are other alternative ways such as lasers and things like that we also employ, and they're also successful to some degree, is regeneration. And regeneration means that if we think about these bacteria when inside the gum and ate some of the bone away, there's a hole right next to your tooth.
Right.
It's not a cavity in the tooth that you clean and fill, it's a hole in the tooth, in the gum area, right? So we open the gum, we gain access to that hole, we clean up the hole very well from the infection, and then we insert a bone substitute. This bone substitute in America, in 90% of the cases or more, it comes from a human source, typically from a bone bank. And it comes in granules, and these granules are inserted into that hole, and then on top of these granules we put what we call a barrier membrane, which is collagen that serves to protect the bone, and then we put some stitches in there.
Oh.
So we are not resecting the gum necessarily as in the first procedure that I described. We try to regenerate some of the bone that is lost around the teeth. But sometimes we combine a resective approach through a regeneration approach. It depends on the anatomy of the bone loss that you have. Sometimes patients say, well, you know what, doc, my bone went away and I have big recession. What can you do? Can you build my bone back up? It's like, no, the bone doesn't grow as a brick wall around the tooth. The bone grows if you have a hole that is well contained. But if you don't have a hole, I cannot rebuild the bone around your teeth. Nobody can in the world. So that's why we are in this predicament. When we get bone loss very far down into the root of the tooth, we get to start extracting teeth and then start going to the route of implants.
I mean, I am so grateful. This journey has, that I originally embarked on, we had talked about it before because of my mom kind of being my inspiration, and now I've gone through it, but how much I've learned on this, I've spent years now around experts, but it's like, I thank you for sharing that. Because now it actually makes sense.